These days, it can be hard to trust the media. What's true, what's fake, and who is behind the message? I'm a freelance journalist and videographer who has spent years studying the media. Now I'm taking a look at what local, regional, and national news stories mean to us here in North Central Washington. I'm Dominick Bonny, and this is Common Sense. Hello and welcome to Common Sense. I'm Dominick Bonny, and in this episode, we're going to be highlighting some of the unsung heroes of the pandemic, EMS, or Emergency Medical Service Professionals in our region. Recently, I produced a short documentary film featuring EMS providers. It seems like ancient history now after everything we've gone through in the last year or so, but in the spring of 2020, we were all warned to avoid seeking medical attention at our nearest hospital emergency room because officials were worried about overloading healthcare systems that were gearing up for a worst-case scenario when it came to the pandemic. So all of a sudden, EMS providers who get paid to take people to the hospital had no clear healthcare mission and no solid revenue stream during what was shaping up to be an historic healthcare crisis. But luckily, the folks at the North Central Accountable Community of Health had stepped up in 2019 and funded a pilot program to help compensate EMS providers for providing basic preventative healthcare and wellness checks on some of the most vulnerable people in North Central Washington. From Omak and Okanagan to Methow and Twisp to Chelan, Leavenworth, and the lower Wenatchee Valley. It was a pilot program perfectly crafted for a world changed by COVID. Not only did EMS professionals check up on shut-ins and the elderly, but they also provided important connections to the outside world, to folks who feared they were COVID positive and had to quarantine before there were enough tests to go around. Recently, the folks at the NCACH commissioned my company to produce a short documentary film to capture and showcase how EMS providers adapted to serve their communities during the COVID crisis and ask the question, did we learn lessons and make questions that might benefit folks in rural America going forward? It's no secret that there is a rural-urban divide in the quality and access to healthcare. Changing the way we utilize and compensate EMS providers might be an effective strategy in providing better healthcare to rural Americans. So let's take a look.
One of the things that we've done in our community is to identify patients who are struggling at home. So these people might have chronic illness or they might live alone and be elderly. And so what we've done is when we see these people accessing the 911 system over and over again, we have created a program called the Frequent Utilizers Program. And this program coordinates with the primary care physician to address this patient's needs and make sure this person is heard and seen by the community and by the primary care physician, and to stop that revolving response, because it's not good for the person, it's not good for the healthcare system.
It's not all about fighting fires or running an ambulance for Cascade Medical. It's taking a global view of our residents, particularly the older, more health-dependent residents. What barriers do they have to living a happy, healthy life? Do they have bad health? Do they have access to medical care? Are they prone to falls? Do they have transportation issues? Is there general home safety issues? If we can't address it, there are partners out there that specialize in that kind of thing that can address the issues. Partners like Upper Valley Mend, who can deal with housing issues or healthcare access. You know, we have one client that doesn't have a lot of money and does have to go to Wenatchee quite often for medical care. Upper Valley Mend is able to help with money for fuel to help them make all their doctor appointments.
EMS partners play a unique and important role in rural communities, especially during a pandemic. Many people think of the COVID-19 virus as a health crisis, but it's also an economic and social crisis. EMS partners like the Lake Wenatchee Fire and Rescue adapted their services to meet the social needs of vulnerable populations during this pandemic. This year specifically, they tailor their services to support elderly populations who are homebound or are medically compromised and have limited exposure to the outside. They conduct home visits, picked up medications, made sure residents had firewood, and also conducted vital sign checks. Lake Wenatchee Fire Rescue made it their mission to ensure that the vulnerable populations in the Upper Valley were safe and emotionally supported.
Yeah, we've had several partners who've done an incredible job of stepping up and helping us in COVID-19. For example, Lake Chelan Hospital up there, Ray Eichmeyer and his team have done an incredible job of partnering to provide vaccinations, provide testing opportunities. They've worked with several agricultural growers and groups in order to try to vaccinate, as well as schools and small towns. You know, sometimes even going all the way up to Stehekin or Ardenvor, some of these areas that are some of the most remote locations in the lower 48 states in order to vaccinate individuals.
We've gone out to the orchards. We've gone out to packing sheds. We have a large H2A workers, people that come from out of the country to help take care of our produce and things that's being made on our land, and pick it and sort it and clean it and get it ready for people to consume. I mean, what's more important than food, right? And so these people come into the country, and we went out and we were able to vaccinate them. And public health did a lot of good work on getting them tested. But we've done much more than that. We've been to the jails. We've been homeless. We've done adult family homes, homebound people. We've done clinics. We've done schools. We've gone into schools. And there's so much more places we've delivered this vaccine to, because it's the right thing to do, right? If I've got something that will save your life, well, I'm going to make it convenient as possible.
We used to have, for lack of a better term, on the medicine side, we used to have the local hometown doctor, right? There was a doctor almost in every town. But as our system has evolved, as it's grown, as more specialized services become available, now, and it's partly due to a cost funding structure, right? They've centralized services. So imagine if I'm that person who lives in rural Chesaw or Oroville or Tonasket, I may have to travel a great distance. We're not talking about 5 or 10 or 15 miles to a doctor's appointment. We may have to travel 40, 50, 60, 70, 80 miles. And what happens when you're elderly and the weather's bad and you are not comfortable driving? This is something that we see in rural eastern Washington a lot. We have what I call shut-in patients during the winter months. They're okay to drive while the roads are good, but they don't want to drive during the winter months. And so how do you get health care to those people? I think having a mobile component to healthcare is absolutely vital. And it really will set up the system for overall better success.
One of the functions of public health in this pandemic has been to do contact tracing and check in on patients every day via phone. And so as we called COVID positive patients to check on their progress, we could detect when they were worsening, and we had to do something. At that time, I know it seems like forever ago, but at that time clinics were not seeing COVID positive patients, so the only option was to go to the ERs. We knew too that we didn't want to overburden our hospitals and ERs. So having worked and having meetings with EMS, it was a natural partnership for public health. So we collaborated, reached out to the North Central Accountable Community of Health and asked for funding so that EMS could do health checks on those that public health identified as maybe needing extra support, or just people that we were concerned about.
So when we started doing the health checks for public health, we would get an order from public health with the address and everything, and we would go out, and we were spending about a half an hour to 45 minutes with each person because they were very, very anxious. A lot of them were having difficulty breathing, and what we did is we really monitored their SpO2, their oxygen saturation, and also their lung sounds. And that was one thing that public health couldn't do over the phone, is listen to the lung sounds, and that's became really important, especially around, what was it, Lori, day 9, 10? Is when we started seeing things change from day 9 to 14. That's when the people really started taking a turn for the worst, and the monitoring was very, very critical for them. And like Lori said, if we don't transport with a DOH, we can't bill for any of that, so we can't get paid for any of that. So a lot of our services, we were spending a lot of time doing that, and so that funding came in to be very helpful for us to help with our budgeting and stuff, because we are tax-based, and we are a small district. We cover 275 square miles in Okanagan County, so we cover a large area. And so it was very important to have that funding. And with the H2 workers that come in, that increases, just here in our area, that increases our population by about anywhere from 3,800 to 5,000 people, and has already started. So we've already got more people already into our area.
So because of the NCACH funding, the Ag WAFLA, the Washington Farm and Labor Association, saw that model, and they also donated to public health to do health checks on H2A workers, because they were in a congregate setting. Those that were positive were isolated and needed that reassurance and those checks that EMS provided.
So I think the biggest challenge is our rural nature. We cover a lot of square miles, and if you have to maybe have an ambulance go from Tonasket, Washington to Central Washington Hospital, that takes that ambulance out of Okanagan County for a long time. So that's very difficult. We also have a shortage of workforce, throughout our 4-county region, but somehow, due to all these situations, there is a lot of resiliency and a lot of can-do attitude. It's important to partner with EMS because it's totally different. They go into people's homes. They can see what's going on in a home. We all know about social determinants of health, and what else is going on in the patient's home that if they were in a doctor's office, it wouldn't be exposed.
Here we want to make life easier for those that have barriers and have a hard time getting along. Some of the things we do, I put a priority on, is the clients that are willing, I'll do vital signs checks on them. We're able to spot a health problem early or see a change over time that could be addressed by their medical provider. We'll help them find a doctor if they don't have one. We'll pick up their prescriptions if they have transportation issues. We'll go grocery shopping for them if they don't want to go out of the house.
Another thing that we've engaged in as an agency is healthcare communication. We noticed that we learned our healthcare communication from more senior people while we were in school, and we weren't taught how to talk to patients exactly how they need to be talked to. So we've engaged in healthcare communication training, and that's allowed us to meet patients where they're at, to find out what their goals are, and to prevent unnecessary interventions and unnecessary care and transport to the ER. We had an elderly patient who was in this revolving response of dialing 911. He called 911 8 times in 1 year. He's elderly, his wife was elderly, and the reason why he was calling is because he had abdominal pain, severe abdominal pain, and he was having the pain because he had an indwelling catheter, and the catheter would become obstructed, and he had no recourse for solving that issue. So we call 911, and our agency a few times would take him down to the hospital. The hospital would figure out what to do. They would flush it out. It's a pretty simple thing. It's plumbing. You flush it out, and then it works again, and the abdominal pain goes away. So we realized that that was really expensive, to be sending him an hour down the road in the middle of the night with no ride back home to get an ER bill and an ambulance bill. That wasn't good for the patient, it wasn't good for the healthcare system, and it's not good for the healthcare providers. So what we did is we identified this problem, we coordinated with a primary care physician to train our responders how to manage that catheter at home so that when he called 911, we could come and solve the problem right there at home. And that's what we did. He would call 911, we would go, flush his catheter at home, we had all the supplies there, and we would avoid thousands of dollars worth of treatment and sort of the suffering of having to go through a hospital ER stay and a long transport out of here.
It's really simple. Have a relationship with the patient and figure out what the problems are. And lots of times it's not simple one problem. There's multiple things going on. And it's like a cascade effect usually for people. If one thing goes wrong and then another thing causes, and then a medication causes another problem, and then here we are in a disaster, right? And so this is where we try to make interventions, help support them, get them the right resources, navigate them, give them questions, give them the right questions to ask their primary care provider. So then they can have some sort of healthcare literacy and then start managing whatever problems there are or prevent them in the future.
When you really think about it, our funding mechanism in EMS is not adequate, number one, and it provides no incentive towards preventativeness, right? This may sound bad, but the system is really geared for us to hopefully come out and pick you up and transport you to a hospital. The system's also designed so that the only place that we can really transport you is to a hospital emergency room. That may or may not be the appropriate place for your care, right? Maybe you need to go to your family practice doctor, but you have no other way to get there. Maybe it's more of a mental health or chemical dependency issue, and you would be better served and taken care of at a facility like that. So the current funding structure really provides no incentive for EMS. All of us do it currently, but we do it and we don't get paid for it. But there's no incentive for us to really look at what the underlying problem is and how we prevent that. And another piece that doesn't get talked about very often is what I call the upstream cost, right? So we understand that as soon as we take a patient to a hospital and we cross that ER threshold, that there is a significant dollar amount attached to crossing that threshold, right? And that's just in the beginning, not to mention all the other lab tests or other tests that may or may not occur. If we can divert those, if we can divert the people who don't need to be plugging up an emergency room, those are dollars that are saved to the healthcare system. And I think EMS is well positioned to help the entire healthcare system, not only to provide better patient satisfaction and better patient services, but to save the entire system money and reallocate those dollars to where they really should be going, and that's to helping prevent a lot of those repeat problems that we see on a daily basis.
I think there's a huge opportunity to save money by fully using the capabilities that are in an EMS system. And there needs to be some payment reform, in my opinion, in Olympia to recognize this opportunity to really do a pilot project where we can test and see how money could be saved. And I think our region would be a good place to begin.
There's been so much going on since early 2020 that it's easy to overlook unsung heroes like EMS professionals who know their communities, endeavor to know who needs the most help, and work to get those folks that help. After the break, we're going to ask, is there a better approach to the role that EMS plays in healthcare systems in rural America? And we'll check in with Linda Belton with Small Miracles and learn about how you can help make sure that no kid in our community goes hungry this summer.
Flooring is the foundation of decorating. It sets the tone for your home and reflects your lifestyle. At Apple Valley Floors to Go, their goal is to help you make that choice a great experience. You'll find extensive flooring options at their beautiful East Wenatchee showroom. Engineered hardwoods, laminates, vinyl planks, carpeting. Do it yourself or have their professional installation team do the work for you. Family owned and operated in East Wenatchee.
Hi folks, welcome to Save Mart. How can we help you today?
We're looking for a recliner.
Okay, right this way. Go ahead and move this chase on the other side. You can lift this up to lifetime warranty.
Great, I want that one. I would like that one.
That's a great choice.
And I want this one as well.
Okay.
And I definitely want this one.
You'll find it at Save Mart. Full service at a low, low price.
Introducing Alpine Airman. Because every home needs a superhero to eliminate poor indoor air quality, send inefficient operating equipment packing, and cut high energy bills down to size. For heating or cooling and equipment replacement, turn to the experts and the superheroes at Carrier and Alpine Air. We offer the best deals on high-efficiency Carrier products, along with friendly, knowledgeable service and incredible savings to fit your budget.
Hello and welcome back. Before the break, we took a deep dive into the world of EMS providers and learned about how they changed and adapted to meet the needs of the communities they serve in North Central Washington, even though the funding structure they operate under currently means they probably weren't compensated completely for going above and beyond the call of duty. In Methow, Justin Porter and the Aero Methow crew helped a man learn how to properly clean his catheter and avoid expensive ER visits after developing easily preventable urinary tract infections. In Plain and Lake Wenatchee, Mike Perotto and his crew pick up folks' prescriptions if need be, and in the winter they shovel old folks' walkways and driveways so they can get to medical appointments and pick up their prescriptions and other necessities. They also work in tandem with nonprofits like Upper Valley Men to make sure that needs are met in their region. In Lake Chelan, Ray Ickmeyer and his team devoted themselves to vaccine logistics and have delivered and administered vaccines to one of the most remote communities in the lower 48 states, Stehekin. If you're looking for examples of EMS providers stepping up and serving their communities in out-of-the-box ways, even though that might not be in the best interests of their business's bottom lines, you don't have to look far. But why don't we consider EMS to be a part of our preventative healthcare system? They have the ability to reach people in remote areas and assess individual needs without those individuals coming into a doctor's office or emergency room. What's more, they have the ability to assess patients' living situations and spot issues that might lead to big problems in the future, like a dangerous staircase that could lead to an old lady falling down and breaking her hip, or an outdated and faulty HVAC or heating system that could lead to somebody suffering heat stroke in the summer or freezing in the winter. They'll do well checks, they'll check your blood pressure, and they'll even pick up prescriptions and groceries. Yet the business model is such that their payday only really comes when they transport a patient to the ER. And by the time you're dealing with an emergency medical situation, it's more often than not an irreversible situation. So what if we change the way we compensate EMS providers to promote their role in preventative healthcare and adequately compensate them for doing so? How many life-threatening emergencies could be avoided if we use the respect they've earned and the relationships they've built in the rural communities they serve to promote preventative healthcare? How many ER trips could be avoided with better preventative care? Granted, this isn't a one-size-fits-all solution. The needs of patients in rural America and the needs of patients in urban America are vastly different. And maybe that's why we here in rural America need to communicate our needs and advocate for change more assertively, both in Olympia and the hallowed halls of our U.S. Congress. If you'd like to voice your opinion and let our state legislators know that we need to rethink EMS services in rural Washington, contact State Senator Brad Hawkins and both of our 12 district representatives, Keith Gaynor and Mike Steele, using this contact information, which you can also find in the source notes in the transcript of this episode on NCWLIFE.com. Just go to the homepage of NCWLIFE's website and find the full episodes tab up top. Then scroll down and find Common Sense with Dominick Bonny. This is episode 36. Before I leave you, I'd like to highlight another excellent organization with a mission I think we can all get behind, no matter what your political persuasion or point of view. And that's making sure that no child goes hungry in our region. Small Miracles is a nonprofit that has done the Lord's work in the greater Wenatchee area, and over the last decade, they have grown to meet a great need by providing free and nutritious midday meals to children who qualify for the federal free and reduced lunch program during the school year, but who might suffer from a lack of access to those meals during the summer. For the last 10 years, Linda Belton, the director of Small Miracles, has been the logistical mastermind who organizes a small army of volunteers to pick up and then deliver and hand out nutritious sack lunches to children in parks in Wenatchee, East Wenatchee, and Cashmere. Because of Linda and her crew of volunteers, over the last decade, an untold number of kids in this community haven't had to open their fridges and pantries in the summer and wonder what they were going to eat for lunch. As a former latchkey kid raised by a single mother who had to rifle around a barren fridge and cupboards more times than I'd like to admit, anyone who looks out for the well-being and physical needs of children rise to a status near sainthood, in my estimation. But Linda and Small Miracles need help, and that's where you and me come in. I met up with Linda recently to talk about Small Miracles and how they need community members to step up this summer. Here's what she had to say.
We are so excited. We are celebrating our 10th year of serving the kids in our community, of being the folks that are lunch that's in when school is out. We serve the summer lunch program, and we partner with the USDA and the state of Washington. And this year and last year, we're serving breakfast and lunch to the kids. We'll be operating from June 28th to August 5th, Monday through Thursday. And we have a multitude of sites all over the city, from Rock Island to Cashmere. And last year, serving just under 30,000 meals.
Wow. And why is this program so important? Who's really the target, I guess, kid? I mean, what are the kids who really need this service?
The kids who are on free and reduced lunch during the school year, they get breakfast and lunch at school. But when school is out, in many cases, they go without. And that's where Small Miracles steps in, and we come in and we take care of the kids and make sure they have a nutritious meal and they have food and they can enjoy their summer rather than worrying about where they're going to get their next meal.
Absolutely. And how can people get involved? What's the need?
We need volunteers, and we would love for you to sign up to be a food host and host a site to help the kids. This year will be just a grab and go, so it's just give them a lunch and they'll take it home with them. And we would love to have, it takes about 45 people per day to make this program work. So if you are available, if you can spare 1 hour of your time, we would love to have you get involved. You can go to smallmiraclesncw.org/volunteer and sign up for as many places as you are available.
Great. And this is something you can do with kids too.
Families are encouraged to serve together, and the two things that have made this program successful, we think, is one, it takes an hour, and two, families can serve together. A lot of times people ask me, how old do the kids have to be to serve? And I just tell them, well, they probably should know how to talk. Yeah. Other than that, we're good.
Great, awesome. Thank you, Linda, and I will tell everybody I know to help out if they can.
Thank you so much.
To learn more and to sign up to volunteer, visit smallmiracles.org today. Linda could really use your help, and I guarantee it will be a fulfilling experience. That's all for this episode. I'm Dominick Bonny. Join me next time for more Common Sense.
At Wenatchee Power Sports, we proudly offer the Polaris product line. Polaris builds the highest quality side-by-side in the industry, with off-road capability that's second to none. The Polaris pre-order program allows customers to purchase the vehicle they want without having to select from limited dealer inventory. The Wenatchee Valley has year-round access to some of the best ORV trails in the Northwest. Start your adventure here at Wenatchee Power Sports.
I'm Brian Thorpe with Global Car Care, and you're watching NCWLIFE channel.